Well, good morning. My name is Beverly Hampton, and I'm the coordinator for the farm program, and I would like to take a moment to welcome you all to our webinar today. Today's webinar is a part of a partnership with Merck Animal Health that started a little over a year ago to ensure an industry-wide approach to employee training and animal care within the dairy industry. And through this partnership, dairy producers across the country have access to tools, resources, and workshops through the Merck Animal Care Dairy Care Initiative, which is an extension of the Dairy Care 365 Animal Handling Training Program. This webinar series that we have today further builds upon this strong partnership and has been forged in support of the significant efforts of dairy producers to continually improve the care and handling of their animals. A part of this webinar series are 10 different webinars that will cover various animal care topics from calf care to building strong herd health programs like today's webinar, and are designed to help dairy farmers meet the new requirements of the Animal Care Farm 3.0. This partnership between Merck and the farm program is a natural fit. The Dairy Care Initiative was designed to complement the farm program and to help producers meet the farm requirements, including the cow care agreement, developing written standard operating procedures, and the employee training. The Dairy Care 365 initiative was developed to help dairy farmers provide the best animal care by maintaining sound policies, hiring the right people, and making sure that they are properly trained. Since its creation, there have been over 50 workshops held in 23 states to help dairy farmers and their veterinarians tailor the dairy care materials to their farms. And the initiative includes a comprehensive resource guide, the Dairy Care 365 Animal Handling video training modules, which are available both in English and Spanish, customizable templates for animal care policies and SOPs, and free workshops for farm owners, herdsmen, managers, supervisors, and veterinarians. Today's webinar, of course, focuses on herd health programs, and we'll go over how we can implement the herd health programs along with the farm animal care version 3.0. As well as today, we are lucky enough to have Dr. Scott Nordstrom with us. Dr. Nordstrom specializes in immunology, conducting vaccine research and development for livestock, as well as post-pharmaceutical and vaccine studies in dairy cattle. He also provides training in the areas of infectious diseases, vaccinology, immunology, and diagnostics. He has played principal roles in researching the VISTA vaccine line and developing the DVM-DX program. Dr. Nordstrom practiced dairy and equine medicine privately for several years, and most recently as a partner in a veterinary clinic in Dayton, Virginia. In 2001, he joined Merck Animal Health Dairy Technical Service, which is a team he leads today. So a few technical things before we go on with our webinar. Everyone except for Dr. Nordstrom will be on mute for the entirety of the webinar. We encourage you to have questions, and if you do have questions, to type them in the question and answer box, which is to the right of your screen, or in the chat box, which is also to the right of your screen. And at the end of the call, we'll go ahead and read those questions out and let Dr. Nordstrom answer as many as he can. So again, I welcome you, and I'm going to go ahead and turn the webinar over to Dr. Nordstrom.
Thank you very much for the kind introduction, Emily. As you can tell from my background, a large part of my time has been spent in the development of vaccines, which I consider to be one of the most critical factors in prevention, which is a primary point of building a strong herd health program. So I'm very pleased to be able to talk to you today about that topic of building a strong herd health program on your farms. The objectives of the webinar today are to discuss the farm requirements as they relate to the importance of a herd health program, and also the development of that herd health program in conjunction with an attending veterinarian. Some of the things that we're going to be discussing today are, of course, prevention, which I mentioned was critical to a herd health program. We'll talk about herd health and animal management. One of the most important things of a herd health program is simply being aware of what is going on in your herd and what are some of the things that we want to look for. And then finally, employee training, which is critical to make sure that we deliver that herd health program appropriately across the operation. So one of the farm requirements is that a dairy has a written herd health program, and that herd health program should be developed in consultation with a veterinarian of record to prevent, treat, and monitor common diseases. And these are going to include things like mastitis, metabolic diseases, abomasal displacements, pneumonia, and that protocol should be reviewed and updated annually and more often as needed, and it needs to be documentable. You need to have written protocols, and you need to have a date that this protocol has been reviewed. That way we're sure that we keep these things up to date on the operation. A herd health program, as I mentioned, one of the critical components of a herd health program is that it's developed with a veterinarian of record and that veterinarian has a valid client-patient relationship with the operation. Real emphasis needs to be put on prevention, and I'll spend a little bit of time talking about that. It should provide for a rapid diagnosis of problems on the operation or issues with the animals. It should foster quick decisions. It should be updated annually, and it should be documented with a data review and protocol updates as well. A written herd health program should be developed with that veterinarian of record. There should be daily observations. I think the most successful herd health programs I have seen have been coupled with the daily observations of those animals to make sure that it has been carried out appropriately and that no issues are arising, and it should be done by trained personnel. And oftentimes you'll see the owner of the dairies go out there and deliver that observation, which I think is critical to make sure people understand the importance of a herd health program. Regular evaluations and assessments need to be based on the failure or success of the program. We also need to consider new technologies that are occurring. And again, we need to make sure that these protocols are reviewed frequently and updated as needed. And another critical component of a herd health program is accurate record keeping, because that accurate record keeping is what's going to enable us to determine if the program has been successful, to determine where issues are starting to arise, and where we need to have interventions into the herd health program as it exists. So one of the things that we emphasize is the development of protocols. And there's a number of areas that we need to develop those protocols. This includes vaccinations. We need to be able to develop a vaccine protocol that specifies the age of the animals and delivers an appropriate vaccine program to them. We need to have newborn management. We need to have treatment protocols. We need to have planned medical procedures and pain management, pest and fly control, lameness, dystocia. We need to know how to handle non-ambulatory animals, and when euthanasia is required, we need to be able to deliver that in a humane manner. And then, of course, culling and transportation also needs to be part of the protocols that are developed. This may not be an all-inclusive list, but it certainly covers the major areas that we need to consider when we're developing a herd health program. Okay, these standard operating procedure documents that I've discussed need to be written and descriptive documents, and they don't necessarily, oftentimes people think in small operations they aren't required, and they should be in place in all operations, regardless of the size. We can never fully anticipate any issues or emergencies that may occur on an operation. So it's nice to have those documents in place, even if it's your brother-in-law coming over to milk the cows that day. As I mentioned, it just doesn't matter the size of the operation. They should be in place. They should be developed with that veterinarian of record. They're going to be a guide for your employees. They're going to ensure that we have uniform care on the operation. They're going to require annual review, and one of the most critical factors in that is that we train and retrain employees on what's required to perform the requirements in one of those standard operating procedures. And that's been one of the drivers behind the Dairy Care 365 program and the training that we have done to ensure employees are able to follow out a protocol appropriately. I'd like to spend some time talking about a successful herd health program and prevention, because I think, obviously, the old saying, an ounce of prevention is worth a pound of cure, is really important when we look at the success of a herd health program. So we'll talk a little bit about developing your vaccine program. Again, it has to be developed with a veterinarian, and one of the reasons we do that is they're individuals who have been trained in the specific effects of certain diseases. They understand the risks, especially associated geographically with an operation. It should be designed to protect against endemic diseases. So what do we mean by an endemic disease? There are certain diseases that if we own cattle, it is critical that we provide prevention for those diseases. And an example would be IBR, BVD, BRSV, clostridial diseases. Those are mandatory that we have some kind of vaccine to protect our animals, especially when we move them into a confinement situation. And we know that some diseases like IBR can recrudesce and remain dormant in an animal, much like chickenpox remains dormant in people. It's the same class of viruses. So that's what I mean by an endemic disease. We need to make sure that the vaccines that we're utilizing are based on evidence-based medicine. So we need to know that what's the risk of that disease occurring, what's the effectiveness of the vaccine, and then we can consider whether or not to institute it on our operation. We need to determine the effects of performance. Vaccination, there's actually over 50 antigens that we can vaccinate cattle for. It's probably getting closer to 75 now. So there's a lot of things that we can vaccinate animals for, and the response to a vaccination is not free metabolically to those animals. And one of the things that we've looked at is what's the metabolic cost of vaccination on lactating cows to see exactly what the effect on production is. We know that just vaccinating an animal with saline will drop our milk production 2 to 3 pounds for about 12 hours. When we start to actually put antigens in there, we can have some pretty significant drops in production. So it needs to be considered. So the point of that is choose your battles and streamline your vaccination protocols to be effective and based on the real needs and requirements of the dairy, fully understanding what the metabolic cost of vaccination is. Oftentimes, we'll utilize gram-negative vaccines. These are things like E. coli, which we know is in our J5 vaccines, or Pasteurellas. And one of the risks of a gram-negative vaccine is that they can contain endotoxin, and it's found in the cell wall of the bacteria that we're trying to provide protection against. Some of that endotoxin is required, but we know that if we mishandle vaccines, we can get excess levels of endotoxin. This actually came from some calves in Florida that were vaccinated in high temperatures and also given multiple gram-negative vaccines by a producer, and this is a calf that had a reaction to endotoxin. So it's something that we need to consider. Excessive amounts can cause severe reactions, and we know that oftentimes we're required to give a couple of different gram-negatives, so we want to separate them and be aware that dairy cattle are going to be much more at risk for reactions to endotoxin than beef cattle. And age and size is going to play a role in that. So it's something that we need to consider when we're developing a vaccine program. Most vaccines are going to have a period of time for them to develop effectiveness. With modified live vaccines, they start to become effective after 2 to 3 days. They aren't fully effective till 10 to 14 days after an animal receives a vaccination. For that reason, it's important that we understand when disease challenge occurs and we administer that vaccination in advance of when that challenge is going to occur. So we want to get the vaccine in well ahead of time if we know when that's going to happen. I think it's really important that we develop flow charts for the animals that move through our operations. We should have a map of when those animals, where those animals are, when those animals are moving, and we should also have an idea of what the disease risk is for those animals at each stage of that operation. So if we know that respiratory disease is occurring when we transition cattle into group housing, let's try and get those appropriate vaccines in 2 to 4 weeks prior to that movement if possible, or at least within a week where we know we're starting to get some effectiveness of that vaccine. One of the biggest challenges that occurs on an operation is in the neonate. With that said, it's important when we consider neonatal vaccination that the first thing we do is examine the management to make sure there's no management challenges. Are we getting colostrum into those calves? Is the ventilation and housing good on those calves? Is it possible for us to vaccinate the dam, which is going to provide protection to that calf through colostrum? And know when we consider neonatal vaccination that we have a higher risk of adverse events. We know that there's some immunosuppression associated with calving. We know that there can be maternal interference, and that's going to depend on the antigen, and it's one of the reasons that we've really focused on intranasal vaccines. We know that it's going to require response time, and it may be longer than typically would be seen in an animal with a mature immune system. We also know that modified live vaccines are going to be effective in those calves. And one of the things I always emphasize, I have probably done more good in developing vaccine programs by pulling vaccines out where appropriate, because oftentimes we tend to over-vaccinate some of these calves, and it really creates a metabolic challenge for those calves, especially if I was going to go out in Iowa today in -8 degrees and these calves are struggling just to meet their energy demands, to ask them to respond to a vaccine. So be careful when we give those vaccinations. One of the things that I like to emphasize is to revaccinate calves after 4 to 6 months when they've lost those colostral antibodies to those endemic diseases. Avoid gram-negative stress points. We can use modified live vaccines near breeding if we know that the animals have been previously vaccinated. And as I mentioned earlier, it's important to consider those after-site challenges. So where are they going next? Are they going to a heifer grower? Have I had an issue with that heifer grower? Can I get a vaccine in there that's going to address that issue before those cattle move to that next piece of the operation? I think it's important that we follow the label directions, and that includes making sure we maintain the product at the proper temperatures. One of the things we need to consider is interference in vaccinations. Can we administer the vaccine on opposite sides of the necks where we know it's going to drain into the different lymph tracts? And it needs to be considered when we look at multiple intranasals. We now have a number of intranasals on the market. So let's make sure the vaccines are safe when delivered together and that we don't have a negative impact on effectiveness. Provide 2 doses where required, and that means in cases where we have to use a killed vaccine, oftentimes we want to make sure that we follow it up with a booster vaccine and oftentimes modified lives don't require that. There's lots of things that influence the success of a vaccination program. Parasitism drives the immune system in a different direction than perhaps a viral vaccine would. Stress impacts the effectiveness of vaccines. We can get overwhelming disease challenges. An example would be a PI in an operation. Genetics, we know that there are certain breeds of animals that are genetically more susceptible to certain things. We know we see some of that in Jerseys with a susceptibility to endotoxin, part of that being size related. Nutrition, and then of course management is always a critical factor in our response to vaccination. Okay, we're going to talk a little bit about herd health and animal management. And some of these slides perhaps may have been seen in some earlier presentations. I'm going to talk a little bit about calves. I'm going to talk a little bit, I'm going to talk a little bit about transition cows, how we're going to handle those. We'll talk a little bit about calving and dystocia, and then also bulls and how we might handle that. One of the requirements is that all calves receive colostrum or a colostrum replacer immediately or soon after birth and before they are transported off of the operation. When we look at the protocols to be followed on newborn calves, it's important that the calf receives colostrum shortly after birth, and it should be, colostrum should be about 10% of their body weight, should be high quality, and that quality is going to depend on when that colostrum's been harvested. It should be harvested within a short period of time of calving, and we should monitor the quality of that colostrum, and we can do that with tools like a Brix refractometer or a colostrometer. Another thing that we want to make sure is, do we have those navels dipped on those calves, and have we used disinfectant on them as soon as possible after birth to prevent entry into that navel cord. Another requirement on that calf that we want to make sure we have protocols written for is dehorning and disbudding. It should be done before 8 weeks of age with pain control under the advice of the herd veterinarian. Obviously, that's going to be off-label, and that's why it's important to have that veterinarian involved. And certainly, if we're going to remove horns after 8 weeks, which is not advisable, we should have a veterinarian working with us on those horn removals to make sure we mitigate the pain as much as possible and don't put the animal's life at risk. When we consider castration, it should be done at the youngest age possible. We should also remove the teats on those young animals as soon as possible, just to minimize the tissue damage. And again, we want to consider pain when we perform those procedures on these animals. So let's talk a little bit about the protocols that we want in place for sick animals. We want to have standardized treatment protocols in all animals. We want to identify the animal. We want to have a place to provide an assessment, provide a treatment protocol for that animal. We want to make sure that we have decision trees and flow charts developed. If this, then that. So we need to know, if this occurs, this is the standard procedure that we follow. We need to use the appropriate treatment products, and they need to be products that are going to be approved with the appropriate withdrawals put into place, and we need to be able to assess the treatment success and failure. And that's one of the critical reasons why record keeping is so important, so we know whether those treatment protocols that we've put into place are working. Okay, one of the things that is very critical to a herd health program is making sure that we have a good observation plan in place to assess the herd, to make sure that there aren't any issues arriving and that the program we have in place is successful. One of the best times to do this is when these animals are up and moving, and within an hour of when we may do the morning milking is a good time to do it. Another time for these calves is to do it during feeding periods to make sure things are functioning appropriately on an operation. One of the things that we'll observe for is making sure that our cow density is not too heavy. It's nice if we can have a 1-to-1 cow-to-stall ratio. It's important that we have enough bunk space, so what we want to do is consider how much time does a cow typically need in that stall area, and is there enough space for her to get in there and spend the time she needs to lay down and rest and ruminate on the food she's eating, and then also when she does get up, is she able to go over and feed without any impediments. So that's the importance of cow density. One of the requirements of the farm program is that 95% or more of lactating and dry dairy herd score less than a 2 on the farm hock and knee lesion scorecard. And to review that quickly, there's 3 levels of assessment. 1 would be no hair loss or swelling. 2 would be some hair loss but no swelling. And 3 would be severe swelling and or abrasion through the hide that we would be certainly not wanting those types of issues to occur in our operation. We're going to look at freestall use. We're going to observe for hock and knee lesions, and this is going to be an indicator of perhaps we're using the wrong bedding, or there's rough surfaces or inadequate bedding. Under the best practice, cattle are housed in environments that prevent body abrasion and injury, and fences and gates are made of strong, smooth material, and we don't have to worry about those animals injuring themselves, either being cut, punctured, or bruised because of the environment that we've provided for them. One of the other things that we want to do is make sure that the digestive tracts of these animals are functioning well, and obviously the chewing of the cud is something that is a great indicator to us that those cows feel well and that their digestive tracts, which are important for their milk production, are functioning the way they should be. 90% of all animals should score a 2 or less on the farm hygiene scorecard. A 1 is clean and a 4 is dirty on that scorecard, and we'll take a look at that. You're going to want to observe for hygiene, and this is what those scorecards look like. Dirt on the lower legs is going to indicate that we've got some issue in the aisles. Dirt on the udders and lower bodies can indicate dirty free stalls. We need to consider this hygiene, and this is especially important when we consider things like environmental mastitises that are going to be reflective of the environment that those animals are in. We want to observe how those cows are eating. Can they reach their feed? Cows typically going to eat approximately 11 meals per day, 8 to 10 pounds each time. They're going to need 20 hours of access. How long those cows are away from the food is important. And also, do they always have clean water? Those are things that we need to consider when we observe a herd. We're also going to want to observe the manure. changes in the manure are going to provide us indications on whether or not the ration's appropriate. Loose manure can indicate rumen acidosis or a high pH. Large particles in the manure can indicate that perhaps that food is passing through the rumen too quickly and not having that opportunity to be digested appropriately. So they're all things that you could talk with your nutritionist about when they occur, and certainly an area that we can observe for to assess that herd health program. One of the important factors of observation is to make sure dairy has a written protocol around lameness prevention and treatment. 95% of the lactating and dry dairy cows should score a 2 or less on the farm locomotion scorecard. I know there's a number of different scoring methods available throughout the industry, a 1 to 5, or in this case, they have a 1 to 3, but the important point here is that there should be some scoring and monitoring of lameness to make sure there aren't any issues arising that can be addressed to mitigate that. You need to determine the cause of sole ulcers, abscesses, white line disease, digital dermatitis, and foot rot. You need to record it appropriately, check the records to determine whether there's been any changes, and some of the benchmarks that we use are greater than 10% lameness is a problem, less than 5% of treated lameness should be due to sole ulcers, less than 25% of any group should have sole hemorrhage, and less than 50% of lameness should occur in the first 60 days in milk. So those are some of the benchmarks that we like to follow when it comes to lameness. When we score lameness, we should observe those cows both walking and standing. And this is kind of a classic scoring. A lameness score of 1, we're going to expect that normal posture and gait, and she's going to take long strides when she walks. Score 2, which would be considered modest lameness or moderate lameness. The animal will stand well, but notice to favor limb when she's walking. You're going to start to see a slightly abnormal gait. And then, of course, we get more of a severe lameness where that animal will stand with an arched back, head bob, take very short strides, and becomes very obvious to us that there's an issue going on with that animal when she walks. 99% of all classes of animals score a body condition score of 2 or more on the farm body condition scorecard. With that said, a 1 is considered very thin, a 5 is fat, and we've all seen the scorecards that are used for that. It needs to be done periodically. It's really important that we consider where that animal is in her milk production to make sure we provide a fair assessment for the operation. And this chart demonstrates that. This is a lactation chart. And we can see that the body condition score is going to drop when those cows are fresh and new in milk. They're pulling a lot of weight off to meet the metabolic requirements of milk production. And then later in that lactation, we're going to see that body condition score go up. So it's important to consider when we body condition score animals that we look across all those different groups, those different lactational groups, to make sure we're at the appropriate area for that group. Culling is another important part of a herd program. It's important that we set rigorous standards that drive our decision making. It's important that we assure cattle are moved into the food chain while they're still in good health, if at all possible. It's important that we follow the withdrawals when we're putting animals into a culling program. And an aggressive program ensures you have the top quality genetics in your operation, and it's also going to help us minimize animal suffering, which is important in an animal culling program. We're going to have culls that are going to be considered voluntary for things like low production that will be sold as beef, and then you're going to have involuntary culls for issues like mastitis, pneumonias, reproductive problems, and they should be handled appropriately depending on what their condition is if we want to move them into the food chain. This is just an example of the reasons that we may remove an animal from production. What's important here is that it drives home the point that we need to keep accurate records. We need to know what we're culling those animals for, because it may drive some questions on, are we getting too many culls for one reason or another, and do we need to address that particular issue? And that's why the records are just as important as those observations to make sure that there are not some issues arising that should not be addressed when we consider a herd health program. We talked about protocols for non-ambulatory animals. When we look at some of the issues that have arisen around dairies and some of the undercover videos that have occurred, one of the critical areas is how have we handled non-ambulatory animals? And it was one of the first areas that we developed some professional training programs for dairies to train their workers. And the goal of the non-ambulatory animal training is to make sure that we can move those animals efficiently and safely for the animal, but just as important for the worker, and to make sure that this is done appropriately and not in an offensive or damaging manner to the animals, and also to the industry. So that's one of the reasons it's so important that we have a very strict protocol, and on large dairies to make sure we have a team in place to make sure those animals are moved appropriately by people who have been trained correctly to do it. The same goes with euthanasia. We have a moral and ethical responsibility to make sure that we deliver those animals a merciful end, because it's just important that we owe that to them, and that is how we handle them if euthanasia is required. And we need to make sure that we have properly trained personnel to do that. I talked a little bit about how important training is, and it's one of the critical areas that we've identified and why we have promoted this dairy care animal handling and video training series. And we have a number of different training opportunities available, including the introduction to stockmanship, how to handle cows, how to move them in the parlors, how to handle the non-ambulatory cows, euthanasia. We spend a bunch of time on calf care, and one of the things that we'll be bringing out in the near future is information around biosecurity. So these are some things that I think are really important for us to make sure that we deliver an optimal program and an optimal herd health plan to those animals, and that it's administered appropriately by our employees. In summary, I would like to say that a strong herd health program is going to focus on prevention. That should be the cornerstone. A successful veterinary-client patient relationship and having a vet of record is the foundation for that protocol. The protocol, or the herd health program, protocols should be written for all critical health interventions. Daily observations are paramount in the success of administration and assessment of the herd health program that you have in place. Our records are very important to determine protocol success as well. So with that, I will open the floor to any questions that may come up, and I would like to thank everybody for joining us today. So I will hand this over to Emily, and she can provide me with any questions that may come up.
Thank you, Dr. Nordstrom. And for questions, if you have any questions to ask, you can go ahead and type them on the right side, either in the chat box or in the Q&A that's down there at the bottom. We do have a few to start us off with. The first one is asking about, I'm going to assume that within the farm program, is pain management required when using PACE for dehorning? In the Farm Animal Care version 3.0, Animal Care Manual, it says that it's under the advice of your veterinarian. So if the herd veterinarian recommends and suggests that pain management is used, then that's what the farm program supports. If it says otherwise, if the veterinarian says otherwise, that's what the farm program supports as well. So then a question for you, Dr. Nordstrom, is are there any differences in your herd health plan in regards to organic farm versus a conventional dairy farm?
Yeah, I think there obviously would be some differences in the treatment programs that are going to be done. I think prevention is going to be critical in those just as it is with any program. Obviously, we're going to put as much emphasis as possible there. So there would be some differences certainly in the treatment protocols that we would use and how we would handle those animals if we did have to resort to some form of treatment. There would be instances where we would not be able to continue to include them in the organic program.
Okay, the next one asks, if the veterinarian does all the vaccinations and treatment and handles all the health-related care, does the farm still need a herd health plan, or why should the farm still have a herd health plan?
The farm should have a written plan for the veterinarian to follow as well. You've got to remember, if it's a farm where the veterinarian is going to be administering all the treatments, there may be different personnel that come out. That veterinarian has to have it written down so he's able to make an assessment and review the program that he has. So regardless of if the vet writes it or administers it, or if it's being administered under the advisement of a veterinarian, you should have a written program that's followed. And I've written plenty of programs when I was in practice for operations that I worked on that were smaller, that I was administering everything. I had it written because I had multiple herds that I was doing, and then I wanted to sit down at the end of the year and review it with the farmer to make sure we felt that things were working as they were expected to be.
Okay, just a reminder, guys, we have a few more, but if you have any questions, go ahead and put those in the text boxes. The next one asks, if a farm has nothing written down, how should they start to create their herd health plan?
Okay, one of the things, if you go into the dairy, well, first of all, visit with your veterinarian and tell them that you want to do this, and create some time to sit down with that individual and write the program up. There's great information available through the farm program, through Dairy Care 365, on how to outline those protocols. So that would be a good starting place. And one of the things we did was a number of workshops. And one of the goals of those workshops was to have people walk out of that with written protocols in place. So that's how I would start on the program.
Okay, I'll also add that there are some example templates and maybe some starting guides that you could take to your veterinarian as well on the farm website under the resource library. The next question asks that if they treat animals with environmental mastitis differently than cows with staph mastitis, do they need separate protocols for each in their herd health plan?
So can you repeat the question? I did not hear that. completely.
I think it's referring to specific protocol around mastitis. If they have two different versions of mastitis, if they have environmental mastitis, if they treat it differently than staph mastitis, do they need separate protocols for their herd health plan?
Well, and that goes to I talked about making a decision tree, and part of that decision tree, if this, then that. So we'll know, based on what my diagnostics are, if I have environmental, this is the way I'm going to go. If I have a contagious mastitis, this would be my plan. So yes, you would have, it could all be contained in the same SOP, but part of that SOP may be a decision tree that would lead you into a different treatment for that animal.
Okay, and then the last question says that they acknowledge that all veterinary clinics are different, but do you have an estimate in a ballpark price of what it would cost to write a herd health plan for a dairy?
Yeah, in a situation like that, you're going to be paying a veterinarian for their time to come in and sit down. Oftentimes, that veterinarian is going to have herd health programs that would provide a template for you based on work that they've done in another operation. So you would be paying the individual for their time, and it would vary depending on how much time would be required. So it wouldn't be easy for me to provide an estimate of what it would cost to do that, because it would all be based on what that vet had available to them. Was there anything written? How well did the vet understand the operation already? Would there be time needed for that vet to understand the operation better before he could write the protocols? So all those things would have to be considered. So it would be a very, very difficult question for me to try and put an actual number on.
Okay. Well, thank you, Dr. Nordstrom, for sharing your knowledge and your time with us today. Our next webinar will be on cattle marketing, and it will be January 12th, and that's actually an error right there. Of course, it will be 2017 in the new year. And as a reminder, all of these webinars are recorded, and you can find them as well as links to the Dairy Care 365 information on the farm website or at this bit.ly link. And as well as you can find the Dairy Care 365 information at www.dairycare365.com. And then if you're looking to find more information about the farm program, you of course can find us on our website or follow any of our social media channels. And we thank you for joining us today, and we hope to see you in January. We hope everyone has a happy holidays.